Hi, today we're going to be talking about the hips and how we can relax them through some simple stretches that you can incorporate into your daily routine. Let's get started. So you can lay on the floor or on a bed. I'm on a massage table here. So what you want to do for one of the stretches for your piriformis, which is right here in the back corner of your hip, that hurts a lot of times when people are trying to move. You can simply do knee to chest. You want to breathe in, and when you exhale, you want to apply the stretch. And you can do this also on your back. You can breathe in, exhale, apply the stretch, and hold for 10 to 15 seconds to start. You can work your way up to 20 and 30 seconds. Okay? Then we're gonna halfway release it. We're gonna breathe in and we're gonna come across at an angle towards the opposite shoulder. Okay? Breathe in, hug the back of the leg, pull towards you, exhale, keep the leg relaxed. I find holding underneath the thigh helps to relax the leg and let it be really just at ease, which enables your muscle to lengthen and stretch longer, easier. Let's do that a second time. Breathe in, exhale, pull underneath. The upper hand can help press down to the side to hold as you are pulling in with the other underhand, just for that extra lengthening. And try to keep your shoulders relaxed as much as you can, as well as your neck. Come out of it slowly. Now this time, I'm gonna scoot over a little bit. We're going to lift the leg up, let it drop over. Make sure you are stable if you do this one or have a partner to help you. Keep your shoulders as square as possible. And if you have a heavy shoe, that can help add additional weight, or you can have a partner to help press on the foot or outer thigh or near above the ankle, just to allow it to drop as far as possible. Deep breath in and let it drop again. Let that hip really let it relax. Do not be holding the leg up. Let it just hang down. This is great to do off the side of a bed. So you just stay stable. And you can also, if you have a headrest, you can hold on to that, or you can have a partner who can help stabilize you on the opposite arm and shoulder. That really helps open up and lengthen the hip and the glutes. The hip rotators get really tight, and just letting it hang off like this is really a relaxed way to be stretching this area of the body. You can do this 20 to 30 seconds, even up to a minute. And just try to repeat if you need to fully relax this area of the glutes. There should be no tension there. Okay? Benefit of the table is I'm able to hold on to the other side of the table with my hand. Okay, now we're going to come up and we're going to do both knees coming up, knee to chest. Exhale. Relax the low back. Breathe in again. Exhale. And rotate. If you have a hip that tends to be tight, then rotate away from that hip, mostly with your circle, for a more of a lengthening. So it's not trying to work. You really want to be using abs and your hands if possible. If you have a partner, they can also have their hands on top of your legs and knees, and they can do the circle for you. The key is to really allow these to relax, your glutes and your hip rotators. Come back to center, stop, breathe in again, and pull in and stretch knee to chest, and relax down. Another good stretch that's nice and easy to do in a chair that almost anyone can do anywhere is have a nice firm chair that your knees can hit the ground and be relaxed if possible. And if you are shorter, just have a box or something, a stool that you can put your feet on flat with your hips and knees relaxed. So for this one, whatever hip is hurting, we'll say left for me, we're gonna lift that knee up, bring the ankle over the opposite knee, bring it as flat as you can, and if you're up like this, that is fine to start. We're gonna take a deep breath in, and we're gonna push down just above the knee, down and away from us. So down and away. Okay, down and away. Relax the ankle. Deep breath in again. Exhale, push down and away. If you need to, you can also use your forearm. You can lean on it, push down and away. You're less stretching the complete hip this way, but this is a good way to start if you don't have good upper body strength or your hip is very tight and it's very high up, then you can just lean on it and push away here. Use your body weight. Don't try to shoulder it. Relaxed, deep breath in, exhale, lean on it down and away. And hold a good 20 to 30 seconds. You should continue to take deep breaths in, exhale, lean a little bit further, and you should feel the hip relax a little bit, and you should feel it in the posterior rear hip area. Okay? Now this next one, we're gonna stay in this same position, but we're going to lean forward after we push down and away. So this one, you may have to work up to it, but you wanna push down and away with your forearm or your hand if that's more comfortable for you, and then lean forward. And you want to hold this one a good 15 to 30 seconds. If you need to start with 10 seconds and build your way up, that's perfectly fine as well. But just stay relaxed, keep your hip as relaxed as possible. Picture opening it up wide as you lean forward. And once you get this where it is more relaxed and comfortable, then you're going to do a little bit more of an advanced move, and you're going to breathe in. On the exhale, you're going to turn away from the hip that you're stretching at an angle and come down as far as comfortable for you. So the hips, there's 6 hip rotators, and some are more aligned straight, others at different angles. So the twisting away is really going to affect those that are tubular and twist, because we've lengthened them, and then we're lengthening them forward and then also at the angle. And then you can also push further down onto the knee, above the knee, sorry. And it's really gonna be helpful for moving and walking with less stiffness and catching. And so leave me some comments down below how this is helping you, but please do not go too fast, go slow. You do not need to do all 3. You can build up over a week's time, several weeks, however long you need. Just do this daily. Do it twice a day, especially if you have a seated position or job where you are in a seated position, and that's really gonna help. Then we're gonna do the other side. But for me, my left hip has been in a car accident as the brunt of it. So I stretch my left hip twice as long as my right hip because it tends to stay tighter. But you still want to stretch the other side because this side is your support side. You lean on it more, so it's going to be tight, possibly just as tight, but your brain is not going to register or scan for tension there. It's going to focus on the injured area that was tight first. So we want to do, I did 30 seconds on this side, so I'm going to do 15-second holds on the second side. Breathe in, lean forward as you exhale. Once you get in position, continue deep breathing and trying to further relax the joint. And then we're going to lean in with our hand. So if you notice on this side, I leaned forward first and then I applied the stretch with my forearm. Either one is fine and safe to do. Whatever's comfortable for you. It's not a wrong or right protocol. Deep breath in again. Lean forward, push down with the forearm, exhale. So I stretch pretty regularly. I have gotten my knee equal to, slightly below the knee I'm not working on, the leg I'm not working on. So you will get more and more flexibility as you practice this. So put this into your routine, especially if you have hip trauma and tension on a regular basis. Again, now we're going to do the one where we come away. Breathe in, push down, lean away from the hip that you're stretching. Relax the shoulders, keep them square, keep your chest upright, but lean away. And you'll feel where you might need to do a little corkscrew, where multiple hip muscles are tight. And then you just hold at the angle that has the most tension. Pause there, deep breath in again, and lean away. And you can apply more pressure on the leg as well. Come out of it slowly. Bring the knee slowly, support it if necessary. And see how it feels. If something still feels tight, you can repeat as many times as you need or as much time as you have. But both sides need to be stretched for sure. Just the side that you know is tight, you feel it on a regular basis, needs to be stretched about twice as long as you're counting your seconds. You can use a timer so you can relax and have it go off, whatever you need to do. My name is Tiffany Daniels. I am a licensed massage therapist. I have several certifications. I have state and national approval for my classes that I teach. And I am going to be doing different joint groupings. This is for the hip. We're going to do neck, shoulders, hips, ankles, and knees. I'm going to try to cover the full body. And so you can utilize one area or all of them. I'll make a playlist and just utilize these for more pain relief, ease of movement, and happier quality of life. Until next time, I'm Tiffany Daniels. Thank you so much for watching. Like and subscribe, and I'll see you next time.